Hi everyone, welcome to another episode of Simply Heal, and today we have again our regular guest, Dr. Jansen.
Hello, Sean. Hello, everyone. Glad to see you again here in our episode.
Well, this week we're back onto cancer discussion. That's always our hottest topic, and of course, it's really great because Doc Jansen is a specialist in lifestyle medicine catering towards cancer patients. So, Doc, today's topic is something that's so important because it's about preventing relapse. Obviously, it's great news when patients discover or they are pronounced cancer-free.
Yeah.
But we keep hearing sad stories about patients who were cancer-free and then 6 months later, they were told that their cancer has spread all over. And this is something that's so tiring for the patients.
Yeah, and it's really sad, you've invested so much time, so much money, so much emotions in your journey, and then suddenly cancer comes kicking you back again.
Yeah, and I think, Doc, many cancer patients asked me, what are they doing wrong? How come the cancer came back? So my answer to them is often that it's not that you did something wrong. Obviously, you did all the right things. That's why your cancer went away in the first place. But the key thing here is you did not do enough. Even during the treatment stage of your cancer, there are things that you should be doing so that you won't have a recurrence later. Like if you're doing chemotherapy, it's so important to protect your bone marrow, your spleen, your immune system. So protocols like Simply Nature extracts for chemotherapy is necessary so that you can prevent a recurrence. But Doc, what are some of the tips that you can give to our listeners today so that they know what they can do right from the beginning to prevent recurrence?
Yeah, okay. So first, let us understand what is the root cause of cancer. Okay? So the root cause of cancer is a genetic problem. Okay? The DNA, so the genes, when replicating, it can have some errors. So normally the body tries to repair that error. Okay? But in cancer, the repair mechanism, the DNA repair mechanisms, there's something wrong that goes
haywire.
First with it, it becomes haywire. So the correcting becomes an error. Okay, and the error now replicates along the next generation of cell lines. Now, when this happens unregulated, okay, when this happens unrelentingly, it becomes a tumor. When it becomes a tumor and metastasizes, when it becomes a tumor, then it becomes cancer. Okay, so now if you can take a look, it's because of the genes. Okay, it's a genetic problem. So we have to do all we can to protect that. Okay, to protect our genes. So what are some of the damages? Okay, what are the things, the factors
that
can
destroy your
damage?
genes?
Okay, it's mainly free radicals. Free radicals can come from a lot of different things. Okay, the way we live, mostly in our environment. But the most important of all is dietary factors. So now we go to the first point. Okay, the food that we eat, there are a lot of things that can promote cancer growth. There are a lot of things or a lot of foods that can also halt or stop the growth of cancer, and on some occasions can even kill the cancer cells. Okay?
Wow.
So what are the dietary practices that we should follow? So take a look at this slide. Okay, so number one, food that you should avoid is dairy products. So
Doc, that's the ice cream, milkshake, everything that we like, from chocolate, milk chocolate to everything.
Yeah, okay, so the reason why? Dairy, that is cow's milk. If you are pregnant, okay, how do you produce milk? It's because of your hormones. So just imagine the hormones of a cow going into a human being. What do you think will happen? Okay, and the milk that is produced by the mother cow is made to grow a small calf to a big cow.
Maybe from 20 kg to 200 kilograms in less than a year.
Exactly. So there are a lot of growth hormones there, and adults, okay, adult humans don't grow anymore. So where do you think that growth will come in? It will come into the tumors. Okay, so the particular the particular molecule found inside dairy products that causes the growth of cancer is casein.
Isn't that found in eggs?
Casein is more found on pastries,
Alright.
meal replacement, or milk powder.
Oh, meal replacement. That's a big fad for many of us because of diets. We
Yeah.
want to be slim.
Casein, okay?
Oh,
So
casein.
take note of that.
Okay.
Don't drink milk, okay? Next is to limit or avoid alcohol. This is common sense. Alcohol is carcinogenic. So if you have cancer or try to prevent cancer, you should not be drinking any amount of alcohol. Okay? It just takes one cell to mutate and multiply unregulatedly for it to become cancer. Okay? So it's in your best interest to avoid alcohol. Let's move on to the next. You have to avoid red meat and processed meats. Okay, this one is already classified by the WHO as a group 1 carcinogen. If it's a group 1 carcinogen, it causes cancer. Okay,
So all red meat causes cancer.
yes, specifically colorectal cancer. But
Wow.
it's not limited to that. There are other cancers that it can cause. But processed meat, yeah, you have to avoid that. So processed meats will be your corned beef, corn tuna, sausages, dried meats. Okay, so those stuff. Okay, so next is the way that we cook our food. Yeah, grilling, frying, broiling. Okay, those can increase the risk of developing these types of cancer.
Colon, rectum, breast, prostate, kidney, and pancreas. This is like all the common cancer.
Okay, so
No,
now
so it makes sense now why cancer is so common because Doc, everything that you said for us to avoid is everything that we indulge in to relieve stress, to enjoy ourselves. We eat ice cream, chocolate.
Now, next one is the food that you should be eating. Okay, so the food that you should be eating are fruits, vegetables, legumes, and whole grains. Okay, these 4 food groups. Why? Because these 4 food groups are very rich in antioxidants. Okay, antioxidants is the one that protects us from free radicals because antioxidants are free radical scavengers. Okay, so if the free radicals inside your body is low, then there's nothing that will damage your DNA. Okay, and also as a bonus, you can actually prevent aging. Okay, yeah. So another one is soy. Okay, so women should consume soy products. Okay, not just in adolescence, but also throughout their life, in order to decrease the risk of developing breast cancer. It's the same thing when you already is diagnosed with breast cancer. Okay, you should be eating soy because studies have already shown. Okay, those women who got diagnosed with breast cancer, if they eat soy, if they consume soy, their survival rate is longer than those who do not. Okay, so it's already a proven thing. Okay, this has already been debunked. Soy should be part of your diet, especially when you are.
Yes, because there was some time ago, I remember maybe 5-6 years ago, they said that taking soya bean would cause cancer.
It's because of the phytoestrogen. So since phytoestrogens, since it's estrogen, right? So it attaches to our receptor in the breast cancer tumor that makes it grow. But actually, they found out that this is not true. Okay?
Oh, it's not true.
It's not true. Yeah, it is estrogen, but the key difference there is that it is a phytoestrogen, meaning it's a plant estrogen. It's not an animal estrogen. So the way they react inside our body is different. So now, if you do this, how much benefit will you reap by doing this? It's actually, you will actually be able to lower your mortality rate from having cancer, heart disease, and dying from all other causes by as much as 25%.
Wow.
Compared to if you don't follow this. Okay, so you can just imagine that impact.
As an encouragement to all our viewers, because if you are like me, you might have been stunned that you cannot take your milkshake, cannot eat your ice cream, you cannot take your fried food, you cannot take your steak and all your meat. You know, research has shown also that if you reduce all these intake from whatever you're taking now to 20% of your entire diet, you are making very good headway, right? That means you will make a big difference to your health already. So I know some of us, when we listen to advice like this, that wow, go plant-based completely, you're like, that won't work for me. I give up. I don't even need to try because it's impossible. I want to let you know that don't be discouraged. You know, if you can reduce your meat intake to only 20% of your total diet, all right, then you already make good difference. And trust me, once you are able to reduce it to 20%, in the future, we don't have to persuade you to move from 20% to lower, you will naturally be able to do it because you will feel all the benefits. Right? So start with that goal to at least reduce your intake. Right? So you eat more salad, you can have your steak. You only cut the 1/4 of the steak. The rest you give it to someone who you don't like. Alright. Because it's cancer causing, and then you can eat your little bit of steak, enjoy your salad, and you can start there. Life is still wonderful. And you can work your way towards a totally meat-free diet in the long run. Alright? So don't feel like you have to go cold turkey. Because I know it's pretty hard. It's pretty hard.
Okay, at least you know the goal. Okay?
You know the goal.
Yeah. So next is physical activity. Now, yes, we need to have physical activity because physical activity can actually prevent us from getting recurrence. Now, how much physical activity should we do?
Oh, that's important.
Yeah, according to this study, how much benefit would you be getting from physical activity? Cancer survivors, okay, like you, trying to prevent cancer recurrence. Cancer survivors who complete 15 met hour per week of physical activity can lower their risk of dying from cancer by as much as 27%. So that is really huge. Now, next question.
That's a 1 in 3, just for anybody, that's a 1 in 3 chance. That's very good.
So now, I'm sure all of you are wondering, Doc, what's 15 met hour per week is? Okay, this is some of the examples of what a 15 met hour per week exercise looks like. Okay, if you want to jog, if you are able to jog, then that's 130 minutes per week. So you can just practically divide that into 7 if you want to jog every day. So
that's like 20 minutes a
that's
day.
like 20 minutes a day. Okay, that much jogging. Right. If you are not a jogging person, I mean, if you are a person who does not like to jog, you can just go brisk walking. If you do brisk walking, that's 250 minutes per week. Okay, divide that into 7. That's going to look like around 30 minutes a day, right?
Yeah, brisk walking, 30 minutes a day.
So if you are someone who is a little bit more frail, so it's just like walking that you can do. Yeah, you can still do it. But it's just going to take a longer period of time. So it's going to be 400 minutes per week. Okay?
Doc, when I look at this exercise examples and our diet, it's no surprise that many cancer patients experience recurrence. Because just looking at this 130 minutes per week divided by 7 is about 15 minutes of jogging per day, every day. So for everyone, this is just the hard truth coming out at you. The whole world is feeling it after the pandemic. Many people don't feel well because for the last 2 years, we really have not even come close to the brisk walking or light walking 400 minutes per week. That means 1 hour of walking every day.
Yeah, that's an hour of walking every day. Correct.
We don't walk an hour. I think if we walk 20 minutes, that's already fantastic. All right. So if you're a cancer survivor or if you are going through cancer treatment, Doc, this exercise, is it something you advise for a patient going through cancer treatment as well?
Yeah, as well. Yeah. More importantly, if you're going through cancer treatment, but I know it's easier said than done because
that's why you have to be on Simply Nature PIPA protocol so that you can do exercise while you are going for your cancer treatment.
Absolutely. So you can just imagine you going through chemotherapy, radiation therapy. You can still go to the office, work. Yeah. So go home and still be okay. But of course, you will feel side effects. But it's the fact that you can go to the office to work, right? I mean, it's already an amazing thing.
It is very important to everyone that you get enough rest, which is the next topic. But the times when you are actually awake, it is important not to just sit around. You got to move. That's how our lymphatic system works, right?
Also, you have to move so that
it's like you need to circulate. You need to pump all that immune system around your body. You can't just sit down. All right. So now we talk about rest. So how does rest come into the picture?
Sleep. Sleep is a little bit, the impact of sleep is a little bit less than nutrition and physical activity, but sleep is again very important. But the sweet spot for sleep is between 7 to 8 hours. Okay? If you go less than 7 hours of sleep, there's a 36 more likelihood of developing cancer among Asians. Okay? And if you go beyond 8 hours, more likely to 21% more likely to develop colon cancer. But the data is not consistent for this, but sleep is nonetheless important. So the other more important part for sleep is dying from heart disease or dying from all other causes. because if you have less than 7 hours of sleep, there's a 12% increased risk of dying from all other causes. And if you sleep more than 8 hours, there's 30% increased risk of dying from all other causes, right? According to this study. So the next one is avoiding risky substance use. So this is one is alcohol and smoking. This one is already common sense. Everyone understands this already, that alcohol drinking and smoking causes cancer. So it will be in your best interest to avoid doing so. Okay?
Doc, we've talked about all this. So in your experience, are there patients that should have not gotten recurrence, but because they didn't adhere to? I mean, do you have any patient cases that you can share with us?
Yeah. Okay. Actually, this was a patient of a colleague of mine. Okay. So this patient was a cervical cancer patient, already done with the chemo, radiation, surgery, and all. And after 5 years, the patient really missed fish. It's fish. Yeah.
Oh, we always thought fish is the safe meat.
Yeah, it's not. Okay. So lo and behold, after a CT scan, a routine CT scan, the patient had a recurrence. So it's really sad. After 5 years of all this, right, the cancer came back.
It was like a period of eating fish, or just one?
No, it's a period of eating fish.
Also, she thought that she misses meat so much, so
Fish.
she thought fish was safe.
Yeah, and she got the recurrence. Okay. I do not know how long she ate fish prior to the diagnosis of recurrence, but yeah, the fact that she ate fish again, so there you have it. So it's very important that you adhere to this protocol. And of course, the way that we live, the way that we live influences a lot our genes, the root cause of cancer. It has already been shown by this evidence that our environment influences gene expression. Okay, so it's really very important. So it doesn't mean that if you have cancer, a family history of cancer, that you'll get cancer as well. It's not true anymore. The power is entirely within your hands, whether or not you will get cancer. Okay?
And Doc, before we finish, I just want to ask, because for many of our cancer patients, those who are finishing their chemotherapy or they just finished with their surgery, sometimes oncologists, or oftentimes oncologists, will recommend 1 or 2 additional cycles of chemotherapy, even though they say your tumor is pretty much gone. So maybe 5 years ago, many of us would hesitate, because if we have already gone through 8 cycles of chemotherapy, we don't even want a single extra one, because it's not easy. But recently, one of my friends actually avoided doing the extra cycles of chemotherapy. After 2 years, her breast cancer spread to her brain and her lungs. So in review, if she had taken the extra 2 cycles of chemotherapy, it would have most likely prevented this recurrence. Is that the case? And how do you advise people right now? Should they take the extra 1 to 2 cycles of chemotherapy? Is their oncologist trying just to sell them more chemotherapy, or is there a real medical reason why you need to take that?
There's wisdom behind that, okay? Because we are just trying to make sure that you are clean, okay? There's no more cancer cells by giving you an extra or 2 extra more cycles of chemo. There's wisdom in that, but the problem there is, even if the onco gives you this 2 more extra cycles of chemo, if you do not follow the lifestyle prescription or the lifestyle changes that we have just mentioned, chances are you're going to get the recurrence as well.
Doc, what's the advice about taking that extra chemotherapy, and even normal chemotherapy? What should the patient who's undergoing chemotherapy, whether it's the standard or the extra last 2, what is their primary things that they need to take note of?
Yeah, okay. So now, giving it the extra or going for the extra 1 or 2 chemotherapies, there's wisdom behind that. Okay, so we just want to make sure that there's no more recurrence, or all cancer cells have been destroyed. Now, of course, if you do not live properly, or you do not have the proper lifestyle, then even if you get those 2 extra chemotherapies, eventually the cancer will come back. Okay? But as much as possible, we want to preserve your immune system, because giving 2 extra more chemotherapy can, of course, make your immune system, weaker again. Okay? So if you have a weaker immune system, of course, cancer can come creeping back in again. Okay? So you also want to preserve your immune system as much as possible. That's why you have to practice these lifestyle habits immediately. Okay, and of course, we cannot avoid the side effects of chemotherapy. So we can always have Simply Nature PPARs to help, you know, boost your immune system, modulate your immune system so it doesn't go down so much. Okay.
So that's the really key important fact when you're going for chemotherapy, because the fear of chemotherapy has always been that you damage the normal cells and that you hurt the immune system. So if you can protect your immune system, like your bone marrow, which produces your red and white blood cells, which are key to your immune system, then you basically control the negative effects of chemotherapy, or rather the more serious negative effects of chemotherapy. So for all patients undergoing chemotherapy, do not forget to take your Simply Nature PPAR extract protocols, not just the tablets. You need to go for the extract. If you're doing very well in chemo, soft gels. If you're really feeling the heavy effects of chemo, then use the powder or the liquid extract. All right? So Doc, I think we've covered all the key questions and key points for recurrence. So let's go to our Ask Me Anything segment.
Yeah, I'm already seeing a lot of questions. Okay, so see you in the Ask Me Anything.